Hello everyone, welcome to another video on Step 2 CK Pearls by Books, Medicine and Scrubs. Today we're going to talk about the management of hepatitis A, E and C. Now as we all know, what are the different kinds of hepatitis? Hepatitis A, B, C, D and E. Today we're going to just talk about A, E and C. B and D will be discussed in a later video. Okay, so what is hepatitis A? It's a hepatotropic virus and it's transmitted by the fecal-oral route, especially from raw shellfish, which is greatly tested in the Step 1 exam. It is usually more common in places where it's endemic to, like South America. So if you have a question where somebody is traveling to these places or has recently come back after vacationing in any of these places where hepatitis A is endemic, then you should suspect that they have an infection if they come up with symptoms. Now, what is important is that what kind of antibodies will you see? In case of an acute HAV infection, you will see increased IgM antibodies, whereas chronic infection will have elevated IgG antibodies. The patient will have fever, malaise, and jaundice, and AST and ALT will be elevated. That is, the liver transaminases will be elevated. This jaundice, it resolves in 1 to 3 months, and there is no chronic infection. So what is important in hepatitis A for your exam is that it does not cause a chronic infection and only supportive treatment is needed. Now, immunization for hepatitis A virus. It is recommended since 2006 in all children who are older than 12 months and also people who are traveling to endemic areas. However, if somebody is less than 12 months old, has chronic liver disease, then in these people you would rather go for immunoglobulin treatment instead of vaccination, and that gives just a mere 3 months of protection. So by this we know that vaccination is way more superior to immunoglobulin therapy. Now the treatment of hepatitis A virus is prevention. Prevention is the best strategy. Why? Because if somebody is infected and comes in contact with other people, they have a high chance of getting the virus from them, and so whenever you hear of somebody being exposed to hepatitis A or having traveled to a place where people have hepatitis A commonly, it's always recommended to vaccinate them if they have not been vaccinated before. There is no antiviral therapy available for hepatitis A, and it's a relatively mild condition, so you don't even need it. The test and treat strategy here is not correct. If you get this in the question and mark it, it'll go wrong, because testing and then waiting for reports and then treating is not right. You want to give vaccination right away, because it can be a debilitating condition for a month, because it takes 1 to 3 months for the jaundice to recover. Now, this is a mnemonic here. Hepatitis vowels A and E are through bowels. So both hepatitis A and hepatitis E, they spread through the bowels. They spread through the fecal-oral route. So this is a nice mnemonic which will help you remember it. Now we come to the next kind of hepatitis virus, that is hepatitis E. Now as you see in this picture, we've shown a pregnant lady, and the reason we did that is because hepatitis E is similar to hepatitis A. It causes a mild infection too, and it does not cause chronic infection. However, if a woman who is expecting catches the virus, then she can get fulminant hepatitis. For that, we have a small sort of mnemonic here too, which says women who are expecting are fully aware of the risks. Pregnant women with hepatitis E can develop fulminant hepatitis. Here you need to pay attention to the E and the F here, and then the E and the F here. So E and F: expecting, fully aware of the risks. Pregnant women with hepatitis E can develop fulminant hepatitis. Up to 20% of the cases develop fulminant hepatitis, so that means it's a big number. It's life-threatening for the mother and the child, and there is no vaccine available. Hence, it's really important to make sure that pregnant women are not exposed to hepatitis E. Now, the transmission takes place through fecal-oral route, like contaminated water, contaminated food. It's also uncommon in the US, like hepatitis A, but common in endemic countries like India, West and North Africa, Middle East, and Mexico. And mild hepatitis in most people except for pregnant women. The affected people are not carriers, and no chronic hepatitis is seen. So there's another statement here: vowels A and E, acute hepatitis; consonants B and C, chronic hepatitis. So the vowels, they are through bowels, and they also cause only acute infection, and there's no chronic sequelae. It recovers completely. But the consonants B and C, they cause chronic hepatitis, which can lead to liver cirrhosis and liver cancer. So they are more serious, and they're more important too for your exam. So in hepatitis E, you will see that during the acute infection, just like hepatitis A, IgM antibodies will be raised, and IgG antibodies will be raised in case of past infection. They've not written immunization here because there's no vaccine available. You can also detect hepatitis E virus RNA by the PCR test from stool up to 3 months after symptom onset. Now, hepatitis C, this is very, very important. Why? Because 85% of the people who catch hepatitis C virus, they develop chronic disease, because the acute disease is often asymptomatic, so it's not detected, and it's only detected once the patient gets chronic disease, like liver fibrosis and hepatocellular carcinoma. It's spread by IV drug use, needle stick injury, etc. So the route of spread, the route of transmission, is parenteral. Now, the acute infection has fever, malaise, tiredness, fatigue, and jaundice, but the chronic infection can lead to liver fibrosis and cancer. So acute hepatitis C is defined as infection in the first 6 months after exposure. Chronic hepatitis C is infection beyond the first 6 months after exposure. These definitions are important, and this, as opposed to hepatitis A and E, the vowels, this hepatitis C is very, very common in the US, because 2% of the US population has hepatitis C infection, chronic hepatitis C infection too. Now, the transmission can be through needle stick injury in IV drug users, because they often share needles and they have increased incidence of HIV too. Then accidental pinprick in healthcare workers. Healthcare workers often get infected themselves when they're treating another patient who's positive. Blood transfusion, dialysis, organ transplantation. Sexual transmission is less compared to HIV and HPV. Perinatal transmission from mother to child, people born between 1945 and 1960, and prison inmates. This date is given here because when these people were born and when they were around, let's say, in their teenage, that was the time when the transmission was highest. So this age group, if you get, then you should assume that they can have hepatitis C if they have liver cirrhosis and symptoms like that. Now, the clinical features. There's a 2-week to 6-month incubation period. After that, you have an acute course, which is asymptomatic in 80% patients, which makes it more dangerous. Then, in 20% people, it's symptomatic and can have malaise, fever, myalgia, arthralgia, and right upper quadrant pain, where you have tender hepatomegaly. Nausea, vomiting, diarrhea is also seen in jaundice, and pruritus or itching all over the body. Now, chronic course. It's seen in 85% of asymptomatic people, and as the disease goes undiagnosed in these people. Liver cirrhosis can be seen in 25% cases within 20 years of the infection. The features are, first is they have hepatic and extrahepatic features. The first extrahepatic feature is mixed cryoglobulinemia. You can have type 2 and type 3 cryoglobulinemia when they occur together. It's called mixed cryoglobulinemia. So what's type 2? It's monoclonal IgM and polyclonal IgG are raised, and in type 3 both polyclonal IgG and polyclonal IgM are raised. Lymphoma can be seen, autoimmune hemolytic anemia can be seen. The renal manifestations can be glomerulonephritis, especially membranoproliferative. So there'll be proteinuria. Then there'll be polyarteritis nodosa, which is a middle vessel vasculitis, medium-sized vessel vasculitis, and Sjogren's syndrome. Dermatologically, you can see porphyria cutanea tarda, as you can see in this image, lichen planus. In endocrine symptoms, there's diabetes and autoimmune thyroiditis. This is a nice flowchart showing the hepatic and extrahepatic manifestations. So in your hepatic manifestations, you can see inflammation of the liver, fatty liver, fibrosis, cancer in the liver, and also cholangiocellular carcinoma in the bile ducts. Here you have mixed cryoglobulinemia, you have membranoproliferative glomerulonephritis, lymphoma, Sicker syndrome, autoimmune thyroiditis, atherosclerosis can cause heart disease later in life, type 2 diabetes mellitus. Then you have myocardial dysfunction, which can cause MI. Cognitive impairment is there, fibromyalgia syndrome is there. So you can see that it has even more extrahepatic manifestations than hepatic. So HCV is a pretty dangerous virus. Now the diagnosis is through ELISA for HCV antibodies, PCR for HCV RNA. If this comes out positive, you do PCR. LFT, which will show raised AST-ALT. The ratio of AST-ALT is important. If it is less than 1, then it's acute. If it is more than 1, it's chronic infection. Acute and chronic. Decreased protein, decreased albumin, all these are produced by the liver. Liver biopsy can be needed for evaluation of fibrosis. Now treatment. Excuse me, I had to take a drink of water. So the treatment is direct acting antivirals. Example, ledipasvir plus sofosbuvir given for 8 to 12 weeks. Sofosbuvir and velpatasvir for 12 weeks. Interferon and ribavirin. Ledipasvir, this name is so complicated. Ledipasvir is a non-nucleoside polymerase inhibitor. Sofosbuvir is a nucleoside polymerase inhibitor. Velpatasvir is a non-structural protein 5A inhibitor, which is needed for RNA replication. The end-stage liver disease, if that occurs in the patient, he will need liver transplantation. Complications are liver cirrhosis and hepatocellular cancer. Now further, all these patients should receive vaccination for hepatitis A and B, because if they get these viruses after getting hepatitis C infection, it will be more severe. Individuals more than 12 years old with chronic HIV infection should get directly acting antiviral treatment regardless of severity of disease according to current WHO guidelines. Breastfeeding doesn't transmit the virus. Okay, a C-section doesn't reduce risk of transmission. Infants should receive vaccination for hepatitis A and B, but they should not receive these drugs. These drugs are actually lifesavers, namely ledespavir and sofosbuvir and velpatasvir. They are new drugs and they have shown tremendous progress in the treatment of hepatitis C. It's 100% cure. It cures the virus completely, and it's a very good drug. And however, it's 12-week treatment and it can be really expensive, up to $80,000 to $95,000 for that period. So we are trying to make it more available for everyone. However, it has totally changed the morbidity and mortality due to this virus. So that was all. I hope you understood hepatitis A, E, and C well by the end of this lecture. And if you like my content, you can follow me on Instagram at Books Medicine Scrubs. You can see more of my journey there. And keep learning. Thank you.